Hello, my name is Cassandra Frost Fletcher, and this is my Unit 2 XP assignment. According, according to the Centers for Disease Control and Prevention, in 2014, a total of 249,078 babies were born to women between the ages of 15 and 19 years of age, for a birth rate of 24.2 women within this age group. This is a historic low for U.S. teens, dropping from 9% from 2013. Birth rates fell 11% for women aged 15 to 17 years of age and 7% for women aged 18 to 19. Also conducted a study in 2015 which found among U.S. high school students, 41% had had sexual intercourse. Had sexual intercourse during the previous 3 months, and of the 30% who had sexual intercourse in the previous 3 months, 43% did not use a condom, 14% did not use any method to prevent pregnancy, and 21% had drunk alcohol or used drugs before sexual intercourse. 10% of sexually experienced students have ever been tested for HIV. The study also found young people aged 13 to 24 accounted for an estimated 22% of all new HIV diagnoses in the United States in 2014. People aged 13 to 24, 80% were gay and bisexual males. Half of nearly 20 million new STD reported were among young people between the ages of 15 to 24. Began with the revolutionary idea that women should have the information and care they need to live strong, healthy lives and fulfill their dreams with no limits. Planned Parenthood turned 100 and is a trusted healthcare provider, informed educator, passionate advocate, and global partner to similar organizations who share their values around the world. It delivers vital reproductive health care, sex education, and information to billions of men, women, and young people around the world. In July of 2015, a bill was introduced to defund Parenthood. In September of 2015, this bill passed the House and was placed on the Senate legislative calendar under general orders. The calendar identifies motions awaiting Senate floor actions. Defunding Planned Parenthood would only cause taxpayers to pay more in taxes than the original amount to fund Planned Parenthood. If federal funding is removed from the organization, the organization must continue ran off donations and payments, which will not likely be enough to continue running the program. Without it, some poor Americans will be unable to afford birth control, and the population it serves will see an increase not only in childbirths, but in the rise in sexually transmitted diseases as well. The population of Planned Parenthood, because of the population Planned Parenthood serves, they are usually less fortunate and will not be able to seek primary care care for help. They will look to emergency rooms for something a quick office visit will usually be able to fix. Defunding the organization, the government should dictate and say what government funds can be used. What government funds can be used for, such as for preventative control, condoms, sex education, and what it cannot be used for, such as abortions, pregnancies, and STD testing. This way, the government only provides funding to the preventative measures of the organization and not to what is considered the consequences of poor decisions.